Well, welcome to Connecting Michigan for Health. I'd like to thank everybody for joining us. I'm Tim Pletcher, the Executive Director for the Michigan Health Information Network, or MiHIN. And it's been a wonderful year. We're still amidst COVID, but the good news is we've shifted from reporting on COVID testing and moved into immunizations. And, we're on our way as a state through this journey. We have had a lot of changes at MiHIN over the last year. We've actually closed a couple of our office and embraced going virtual pretty much all the time. This has really been empowering for us because we've been able to recruit people from all over the country, experts in different fields. When other people have found it hard to find staff and talent, we're able to actually bring people who've had years or decades of experience in the spaces we need. And we've needed their help. We've needed their help to really become better operationally. We've continued to grow. We've continued to do more things. But as we've gotten bigger, the back end operations have really demanded a whole new level of excellence. So when you look inside the organization, which many people don't see, but you will experience, we've really retooled, re-engineered, and redesigned an awful lot of how we do things, whether it's moving to Agile for our software development or creating an entirely new service delivery model that sort of embraces a red-blue continuous process where we basically take new things and put them into production and try to make that a seamless handoff to an entirely new way to do community engagement and really go out into the field, assemble our, for example, our tier 3 organizations, bring them together and create a process where we shift from just deploying technology to really trying to listen to what our customers are telling us and then trying to make sure that the organization as a whole is able to respond. We're also highly committed to the Interoperability Institute and our interns or our apprentices, research associates, we sometimes call them. We've reached over 100 of them per year, and we continue to train really Michigan and the nation's next generation HIT workforce. And finally, we're really excited about some of the leadership that's happening with MELD and open source and the migration to FHIR. And you'll hear a lot about that, whether it's in virtual care or whether it's actually in compliance with 21st Century Cures Act. So there's a lot of great things going on. We continue to try and get further and further, toward our customers and recognizing that healthcare is not just in the office or in a hospital, but with telehealth and other kinds of virtual care really pervading everywhere we live and everywhere we work, including schools and communities. With that, I just want to say a special thank you to our sponsors. This is a virtual event. We really appreciate folks coming out in force and supporting us. I especially want to call attention to Blue Cross Blue Shield, who's our diamond sponsor this year. Blue Cross has been a fabulous partner. And unlike many organizations that many folks think of big evil health plans, Blue Cross has really provided a leadership position in our state. Many of the things that powerful commercial organizations do around the rest of the country is very self-serving. In Michigan, we've seen the Blues really step forward and do a lot of multi-payer, all patient kinds of activities that have essentially risen all boats in the state. And for that, we're very, very thankful. We've done some things in Michigan that no other state has been able to achieve. We've done it without necessarily specific laws being passed or mandates, but we've really got, I think, a good combination of a public-private partnership. And I want to thank Blue Cross, as well as really all the other plans who are now participating in really embracing the Michigan model.